beautiful people. Welcome back. This is Casey Pacheco. I am so happy to welcome you into this space. We have a beautiful, beautiful woman we're going to introduce today. She does the same thing I do. I talk to nurses and she speak with doctors. So let's bring her in. Kim Downey, welcome, welcome.
Thank you, Casey. I'm thrilled to be here and have this conversation with you.
Absolutely. We were just talking just right before the show. We met when you first came onto LinkedIn. I actually had interviewed you before, and you told of your story, what happened with you, what made you so intrigued with doctors. You want to give us just a brief synopsis of what happened, just so if anybody missed that episode?
Sure. So very quickly, I was a pediatric physical therapist working in a local elementary school, and I was diagnosed with thyroid cancer and had surgery, radiation, a complication. Then that went on, and I had some further complications from that. And then I had 2 episodes of breast cancer. So it was constant medical issues for 2 years with more surgeries and radiation treatments. And when I finally thought I was going to be moving forward after 2 years, and I had an incredible radiologist, and I went for what I thought would be a routine visit, and he wasn't there. And I asked where he was, and they said he died a month ago. And I actually said, "Are you joking?" Because I thought I was going to see him any second. I couldn't believe it. And when I asked what happened, they said they didn't know. And in my heart, in that moment, I just knew that he had taken his own life. And I found that to be true. And I felt a calling to support doctors. So that's what I've been doing. And that's how I founded Stand Up for Doctors.
Thank you. Thank you for your work. I just think your story is incredible. And with the high suicide rates happening right now among healthcare workers, I just wanted to give a little backstory. But I know you want to hear the questions I have for Kim, so I'm gonna jump right into it. So Kim, if we don't pay attention to our clinicians, what do you see happening to healthcare in healthcare?
So I would say that we're already seeing it, and healthcare workers are leaving at alarming rates. So during the pandemic, I've heard that any nurse that could leave left, right? And many doctors did as well. So here in the US, I just looked up a McKinsey survey that reported roughly 60% of doctors said they're likely to leave clinical practice altogether within the next 5 years. So that is really scary. And we're going to have an incredible shortage of primary care physicians. So people already are waiting a long time to see a doctor,
Mhm,
sometimes averaging 4 months, depending on the specialty or even a primary care doctor. And
mhm.
they blame the doctor, but there's a shortage. And every time a doctor leaves, then it's even more stress and pressure on the physicians who remain.
Excellent. So, after interviewing so many physicians, what is one thing that you think they can benefit from fellow healthcare workers that they're really not getting?
So I think it's like a little maybe ball of things. And what immediately came to mind was like safety, trust, and time to talk about hard things or anything. And it made me think about the doctor's lounge. And I know some people didn't like the doctor's lounge. They thought it was like elitist and just for doctors and things like that. But that was a space where doctors would see each other in different specialties and say, "Hey, what do you think about this or that?" Or then if they were having a hard time or were decompressing, it felt like a little more like a safe space. But now they don't have those spaces, and lots of times they don't know their colleagues. So
Mhm.
I feel like that safety, trust, and time to talk about the hard things is all kind of wrapped into one.
Ooh, that's powerful. What should patients be aware of when interacting with burnt out healthcare providers?
So what I say is that I quote Dr. Kathy Stepien, who shares that everyone wins when physicians are well, and also when other healthcare workers are well. And if your doctor or your nurse or whoever isn't well physically and emotionally, it impacts their bandwidth to be fully present for you. And if you're dissatisfied with your care in a particular visit, give the clinician some grace, knowing that they might be struggling themselves or having a bad day. Also, though, I've been a patient and I've seen 40 doctors having had all kinds of experiences. And some, if I repeatedly had a poor experience a few times, I can wish them well. And that's why I'm doing this work to support them. But also, especially, I'm blessed to live in an area where I have a choice of doctors. So I actually switched a few doctors out, so that if you try your best, because I felt like I showed up with the best self that I could for a few visits. And if I felt like they were burnt out or just weren't really there for me, to know that as a patient, you deserve to have good care also.
That's excellent advice. Excellent. Because some people may not be healthcare providers, but listening in.
Mm-hmm.
Yes.
Well, also even doctors, like I've heard many, many stories of doctors who had poor experiences with doctors, because that is one thing that surprised me in doing this work. Is I would have thought that at least a doctor as a patient would get like special treatment or good care. And I found over and over again that lots of times doctors are shocked to have poor experiences at the hands of other physicians.
Yes, yes, yes. Thank you for sharing that. Okay, next question. I know you work with a few nonprofit organizations. So let's say 100 investors were watching this and they were ready to fund your solution. Where would you recommend the money go first?
So that's a fascinating question, and I wasn't quite sure how to answer it. So I feel like there isn't one solution right to our broken healthcare system around the world, because these issues are ubiquitous in other countries as well. It's a multifaceted problem and it needs a multifaceted solution. But on a global level, if we could get the best minds together, because there are people who could figure this out. They're smart people. And
Yes.
if we could get them in a room together, and also to make sure that frontline workers have a seat at the table. So
Yeah.
you need doctors and nurses there, the people who are actually doing the work with healthcare leaders and other professionals. So if there was could be some kind of global summit for that, I think that would be incredible. If we're narrowing it down a little to nationally, some of it, and again, since I'm doing stand up for doctors and my work is with physicians, I've come to know that the culture of medicine has to change starting in medical school. And so many things are drilled into physicians that aren't sustainable for them, like put the patient first, at the detriment of your own going to the bathroom, eating, sleeping, drinking. They suppress their own needs, and then they're trained to always put the patient first, and then they get so depleted that they don't really know how to resource themselves. So if we were talking nationally, I feel like we need better training starting in med school. And it's that famous, put your own oxygen mask on before you help another person. And that is so true to make it sustainable. And if I was taking it down even smaller from global to national to my personal mission, as you've shared, like I have a powerful story and I've become a great connector of physicians and others in the healthcare space. So if I personally had some money, I would travel around the country and speak to doctors and patients.
Yes. Oh, I love this. I love this. Thank you for such a well thought out answer. You really touched every base. Thank you.
You're welcome.
So, my next question for you is, what's one impactful message to those who think, they might be looking at the work that I'm doing or you're doing and say, those doctors and nurses, they just need to suck it up. I remember back in the day, and they go on. What would you say to those people?
Well, interestingly, I just recently interviewed a healthcare leader who was a mental health care worker. So when she was a healthcare worker, she worked with kids who were abused and neglected. And she's had personal trauma, so which you'd call primary trauma, and then a lot of secondary trauma, which would be witnessing the trauma of other people. So when she took on a healthcare leader role, exactly what you said. At first, she was thinking, well, her employees, they should just suck it up, because she did, and she was resilient.
Yes.
But then when she burnt out again and had to do the own work to get herself in a good place, that she realized for sustainability in medicine, it is important that we support our healthcare workers. And what she also realized is that it has to start with leadership and leadership transformation and leadership buy-in. And if you offer your employees like a wellness app, but you don't have give them the time or resources to access it, they aren't going to do it.
Yes.
So she said it really has to start with leadership transformation and supporting teams.
I am all there with you. I agree with her and I agree with what is said. But sometimes, unfortunately, not until they burn out do they buy in.
Right. That's very true. So this is why we're trying to change the narrative,
Yes.
to change things before that happens.
Yes. Thank you so much. So my question about legacy, what do you want your legacy to be? What legacy would you like to leave as you advocate for clinicians?
Well, one thing that came to mind is what I said. So I have a physician coach who I told my story to, and that's how I got involved doing this work. And that's Dr. Michael Hirsch. And I had told him early on that I felt like I wanted to be like Mr. Rogers for doctors. So like that I can't help everyone, but I just want that any doctor who comes in contact with me or communicates with me, like sees me as kind and knows that I genuinely care and I genuinely want to help. And that's the legacy, when you think of Mr. Rogers, left a legacy around the world, and every child that watched those episodes felt heard and seen. And that's what I would like to do for doctors.
Oh, that is so, as you say it, I really do see it. I really do see you being like Mr. Rogers for doctors. That is so beautiful. And I really hope they cherish you. I've seen some of your interviews and I know they appreciate it very, very much.
Thanks.
Oh, okay, so coming from your background, because you are a doctor of physical therapy, how has that shaped your approach to supporting physicians? You are leaving your physical therapy and you're branding yourself as the mother of physicians.
Yeah.
So how has that do you get like some weird looks or weird stares, like where is she coming from, or she's not even a physician, why does she care? Have you gotten that?
No, I'd say the opposite. So I do have a bachelor's of physical therapy because I
Okay.
graduated way back in the dinosaur age of 1988 when they only offered a bachelor's. So I'll first confess to that. So when we have our conversation, so as a physical therapist, having practiced for over 30 years, I too experienced burnout and moral injury, and I hadn't been familiar with that term until all of this started right in the last few years. And I could look back, and it's when the EMR started. Like I remember that we would sit at lunch, the PTs, OT speech, wherever I work, because that's the one thing that I'm blessed, like PT, OT speech, we really did tend to have a team approach.
Yes.
And we would work in the gym together, would eat lunch together. And during lunchtime, we would talk about our families or would talk about patients, but in the best way, like, oh, I think so-and-so needs a walker, or, oh, I'm concerned about this, just for the care of each other and for the care of the patients. And once the EMR came, that was gone like that. And we had our heads in the computer because you were expected to, to type in so many information. It had to be done by the end of the day. And then at lunch, it literally changed what I brought to lunch. I would bring something that I could eat with one hand and type with the other hand. And our lunches were gone and that connection was gone. So when little pieces of that come out in my conversations with physicians, they know that I understand.
Yes.
So it's really the opposite. They just so appreciate that, oh my gosh, someone who's not a doctor does understand, or is a patient who had a complication and is willing to see all sides of it. And instead of persecute, see the humanity in doctors and realize the ways that they're struggling and make a decision to support doctors.
Oh, wow. So much of what you say with the EMR and how that introduced burnout, this is something that is so salient today because now we have AI and a lot of nurses and doctors. I've been talking to both of them. They really don't want that to happen again with new technology because it really did take away from our relationship together.
Right. So
Yeah.
true. Yes.
Yeah, I love that you shared that before and after. Thank you for that.
You're welcome.
So my next question I had for you is what's the greatest gratitude or impact you have experienced from your work in physician advocacy? You've been doing this for a while.
Right. So a couple years, it was maybe like almost 2.5 years now. So when I did connect on LinkedIn, and I believe you were one of my very first conversations, and I guess I have to think about, oh my gosh, like people really want to talk to me. I think it surprised me, like, wow, you're going to take time out of your busy schedule to talk to me. And
Yeah.
then when doctors did as well, I don't take it for granted for 1 second when they share their story with me, whether it's on camera or off camera. It
Mhm.
just fills my heart that they trust me. And that's really my greatest gratitude, but also that they thank me every day. And I could say, who else in the universe has doctors, thanking them every day?
Yes, you have. And you started on LinkedIn in about 2023. I remember I saw when you came on, and I was so proud of what you were doing. And then I looked because I was looking to interview. I say, "What? You know, Kim has 6,000 followers." I'm like, "Wow!" But I know this has never been your intention. You have just
Right.
been going with passion and trying to connect with as many people as possible. So I know they're so grateful for you.
Thanks, Casey.
You are very, very welcome. So my last question that I have is, oh no, this is my second to last one. For the doctors who are looking in at this interview and they have not heard about Stand Up for Doctors or all of the beautiful things that you're doing, and they're like, I want to be part of a community. I want to follow her. What's the best way for them to be part of what you're doing?
Sure. So I would say that there's a few ways. And one is if you would like to connect with me on LinkedIn, that's where I am. And all my posts are support physicians. Whatever I say, it's really about physician advocacy. So that's one way. And then in the fall of 2023, I started a Stand Up for Doctors YouTube channel where I interview doctors and others who intersect with healthcare. And if they want to find me on my YouTube channel, Stand Up for Doctors YouTube channel, and subscribe to that. Then we took the first 15 doctors who were guests on my YouTube channel, and we wrote this book, White Coats, Courageous Hearts, True Stories of Doctors Reclaiming Their Humanity in a System That Challenges It. And Dr. Kevin Poe wrote the endorsement on the back. He has me on once a month. I bring him fresh voices of, doctors and others in healthcare. And it's the first in the series, and we're actually working on book 2, so they can find our book on Amazon. And when doctors read it, they're going to feel less alone, and they're going to see themselves in these stories that the physicians share. And it humanizes doctors. So when patients read it, they'll see the struggles that doctors face, whether it's with infertility, struggling with thoughts of suicidality, like any problem that you have, your doctor has them too. In these honest stories, you'll be able to see that. And then I also started a Substack monthly newsletter, also Stand Up for Doctors. And that's where I summarize my monthly advocacy efforts and any in-person meetups I have or book signings, or the YouTube channel episodes. I try to summarize it in the newsletter.
That's beautiful. That's beautiful. And I want to say about your book, Kim, because you said it's on Amazon. It's beautiful if someone's looking at this and say, I haven't thought about my doctor, but I would like to think about them and give them a gift. Sometimes patients want to give them a gift. That's a
Well,
great gift.
yes, well, actually, that's so true. So I actually have a friend who recently had a significant health issue, and he ended up a doctor squeezed him in because there wasn't going to be appointment for 4 or 6 months, and he was so grateful, and the doctor was so kind. When he had his follow up, he actually brought the doctor a copy of the book, and he said though that the doctor almost seemed like embarrassed that nobody ever says thank you or gave him a present, and he wasn't quite sure how to respond. So he knew that he appreciated it.
Yeah.
But I love the fact that he thought of that. And I think it would be a wonderful gift to give any doctor. So thank you for pointing
Yeah.
that out.
Yes, that's awesome. That's awesome. So show the viewers the name of the book one more time. If you want to
Sure.
give your doctor a gift,
It's
White Coats. It's on Amazon.
White
Courageous.
Coats, Courageous Hearts. And if you'd like to know how we came, this is my logo, and it's a patient giving a doctor a hand, which is represented by the cuff sleeve. And I will share that the last time I spoke with my doctor that had taken his own life, I was at the beach, and he called to thank me for my thank you note. So I go back to that beach and I collect pieces of sea glass, and I make sea glass hearts for my doctors. So that was how I have the mosaic heart in the back.
You see why I like this woman? She about to make me cry. You really are about to make me cry. Even that glass, your logo, everything is just filled with so much intention. Thank you so much. Oh,
You're welcome, Casey. Thank you.
so so my last question for you, Kim, is beyond the work that you're doing today, what do you want to leave behind as your lasting contribution to healthcare? Because you've been a physical therapist for over 30 years. Now you're doing this profound work, stand up for doctors. I saw you as part of the foundation. I think I don't want to say it wrong, Lorna.
Dr. Lorna Breen Heroes Foundation, because Dr. Lorna Breen was an ER physician during the pandemic who got COVID, went back to work too soon, ended up in a catatonic state in her apartment, called her sister in Virginia. They got her down to Virginia. They admitted her to an inpatient unit. But when she was discharged, she was afraid because there's intrusive licensing questions on the back. Have you ever sought mental health help? And she was afraid that everything she worked for her whole life would be destroyed, and she took her own life. So now her brother-in-law, Corey Feist, and her sister started the Dr. Lorna Breen Heroes Foundation, and they're trying to remove those intrusive questions on the licensing applications in all 50 states. And I believe that nurses and pharmacists have to answer those two questions as well. And I, as a physical therapist I have my own license that I have to send in. And on the back, it says, like, have you been convicted of a felony in the last year? But I don't have to answer. And that goes against the Americans with Disabilities Act. And the sad thing is that New York had already removed those intrusive questions, and she didn't know it. So the Dr. Lorna Breen Heroes Foundation has made excellent progress. There's many states that have removed the intrusive questions, and they're working very hard to make sure that every healthcare worker, doctor, nurse, pharmacist, whoever, has free and confidential access and support to mental health services, because we have to take care of the people so they can take care of us.
Absolutely. So you're doing all of this good work cumulatively. What impact would you like to leave on healthcare?
So I want every doctor to know that they're never alone, because so many doctors, when they tell me their story or when they've gone public with their stories, they'll say they thought they were the only one. Like they struggled in silence. Doctors are told to put your head down and just keep going. They're taught to be resilient. They feel like they need to be perfect. So any kind of struggles what they were having, whether it was addiction, being upset over a complication or a patient death, they internalize all of it. So I just want them to know, that they're never alone, that there's always a path forward, that there's people who want to help them. There's resources. There's other doctors who are doing this work of, supporting their colleagues, that will talk to their colleagues. And I want every doctor to be able to access whatever support they need so that they can thrive in medicine, because we need doctors.
Yes, we do. Yes, we do. And we need healthy, not burnt out clinicians at the bedside taking care of us. So I am so very, very grateful for not just the work that you do, but the heart and the fierce passion you bring to it. It's just so heartwarming. You catch me every time
Yeah.
because I can feel your heart. I can feel the care that you have. And so many of us in healthcare, we bring every day our heart, our care, our compassion. And to get it back, to get it from someone who is on the other side, just as passionate, caring about our professions,
Mhm.
it's beautiful. It's beautiful. I am so glad that we're connected, that you are a friend, that, I am yet to meet you in person, but I know when we do, it would be like we've been friends for all these years because I feel so,
Exactly.
I feel so, so connected to you.
Yeah. Well, thank you. And where in Florida are you again?
I am in the Winter Haven area. Mhm.
Okay, I will have to look that up because I make some trips to Florida sometimes, less than once a year, but I will have to figure that out.
Well, if you come this way, let me know. I can come and drive and give you a
I,
hug.
I would love that very, very much.
Well, I'm gonna just say thank you so much for allowing me to interview you. To the audience looking in, I asked Kim all of my questions, but no doubt you may have questions to ask Kim. Please leave it below in the comments. Don't be shy. We're both on LinkedIn. She will definitely get back to you. If you have a physician that you want to put in touch with her movement, please be sure to connect with her, and then connect any physician you know to her channels on YouTube and subscribe. Thank you so much for joining. If you're looking at this as a replay, don't forget to subscribe to my YouTube channel, The Spark is Love, where we're bringing the love back into healthcare. And we're so grateful to have you and Kim here with us. We'll see you next week, Sunday at 4 p.m. on Meet the Experts. Thank you so much, Kim.
Thank you, Casey.